All right.
The broadcast is now starting. All attendees are in listen-only mode.
Hello and good afternoon, everyone. My name is Michelle McCready, and I'm the Director of Policy here at Child Care Aware of America. And I'm joined by Nick Vucic, who's our Senior Government Affairs Advisor. And we thank you so much for joining us. For some of you, good afternoon, and for some of you on the West Coast, good morning. For our second part of our series on CCDBG Moving Forward, today we're going to focus on what S1086 would mean for families and providers. So let's get started. Before we get into it, I wanted to make sure that I direct your attention to the chat box function on your screen, that through the presentation you can chat in questions that you may have by typing the message into that box, and we'll make sure that during our question and answer portion at the end of the webinar that we will try to get through all of the different questions that you have, and make sure that you type it in when you have the question so you don't forget and it's top of mind, and we will have that at the end.
Hi, everyone. As Michelle mentioned, my name is Nick Vucic. I handle government affairs for Child Care Aware of America. And before we start into the second of our four-part webinar series, I wanted to make a note that the CCDBG Moving Forward webinar series is designed to provide an introduction into the amended version of S1086 and what, if passed, those in the states will need to be made aware of. In addition to awaiting final passage of the bill by the Senate and the President's signature to become law, the Department of Health and Human Services will then be responsible for providing guidelines for implementation that could alter some of what's discussed during this series. The main thing we want to mention as part of that is we view this as very much helping you guys start the conversation, whether you're a provider, whether you're a family, or whether you're an advocate in the state, or whether you work for a state administration or, in DC as well. We really want to make sure we're putting the information out there to help you. One or two other quick notes is all PowerPoint slides, links to recorded webinars, and registration links will be made available shortly after the conclusion of this webinar at usa.childcareaware.org/webinars. So before I continue, I do want to mention that over the last few days we've gotten a lot of questions, people asking for slides and webinars, or a link to the recording. I'd like to mention that the slides from both the first and second webinars, as well as the YouTube links, will both be up on the website before the next webinar on Tuesday, before part 3 of our series. So if you're having trouble accessing it prior to our webinar on Tuesday, just send me an email and let us know, and we'll make sure you get the information. And lastly, I also wanted to mention that Child Care Aware of America is unable to offer participation certificates for this webinar series. Even though we have been able to in the past, we won't be able to this time. But we do appreciate your attendance nonetheless.
Okay, great. So we at Child Care Aware of America, I just wanted to give you all, for those of you who are joining us for the first time, a little bit of background about who we are and what we do. Our mission is, as the nation's leading voice for child care, to support the development of an effective child care system that supports the healthy development of all children. And a little bit about us is that since 1987, Child Care Aware of America has been working to improve the system of early learning for children by doing the following activities. First, we provide training resources and best practice standards to local and CCR&Rs that support high-quality, accountable services. We also promote national policies and partnerships that facilitate the universal discussion and access to high-quality child care. We collect, analyze, and report on current child care data and research trends, including child care supply and demand. And then we also offer child care parenting information and resources to families, connecting families to their local child care resource and referral agencies throughout the nation. So for those of you who joined Tuesday, I'm going to quickly be a little repetitive with some of the information that I'll be sharing to give some more context about what the Child Care and Development Block Grant means for families and providers across this country. So for those of you that are new, this will be new information, but for those of you, thank you for listening again to some of the repeat. So I wanted to talk a little bit about the child care landscape, and it's not just child care. We have to, and we always think about it as a continuum of services. We hear that it's a patchwork of federal programs, but in reality there are only a few larger core early learning system components that reach families and children in different places. So that could be at home or in organized programs. All these different services meet needs for children and the child development plus the parents' needs at different time in the child's life. So as you can see, the majority of what we'll be talking about today is child care, and specifically the Child Care and Development Block Grant program. But I wanted to make note that there is the home visiting program, which really supports families and families that are expecting a child, also through the birth to 5 years. The Early Head Start, which is primarily infants and toddlers, 0 to 3-year-olds, also into Head Start, and then also the pre-K, state pre-K systems that are in place. So this is really a comprehensive landscape of all the different entities of not only child care, but the early learning system. So a couple of facts and figures about child care in the United States are that nearly 15 million children of working parents are in some type of child care arrangement, and out of those 15 million, around and over 11 million of those children are under the age of 5. And on average, they spend about 36 hours a week in care, so that's a pretty full week. At least 1 in 4 families piece together their child care as they are placed in multiple arrangements. So that could mean they do maybe a child care setting in the morning and then an early head start program in the afternoon, or that they're in a child care program in the morning and then they may go with grandma or auntie or uncle in the afternoon. So really 1 out of 4 families definitely have a pieced together system where there's multiple arrangements for their children. And almost 60% of the cost of child care is assumed by the parents, and that's actually more in some states. And that's spending more than 30% of their monthly budget on child care, which exceeds rent, utilities, transportation, and food potentially in their budget. And just another plug for our Cost of Parents and High Cost of Child Care report that we put out annually. This year we will be releasing that report on December 4th to really give you a bigger picture of what parents are dealing with as far as child care costs. So to talk quickly as a recap of the child care system, today we're going to focus on what the Child Care and Development Block Grant, specifically the changes on the horizon, mean for providers and families. But just to give you a little background about CCDBG, it's a federal grant program that provides assistance for families and funds quality initiatives in the state. A little history is that it was signed into law in 1990. And then the last time it was reauthorized, although there was a couple of attempts, the last actual reauthorization happened in 1996 as part of welfare reform. And really, states have great latitude and flexibility on implementation of the policies and to really set the framework in their own state for what the different licensing standards are and the laws are in their own state. But the current federal law of CCDBG, as of right now, does not require a background check for child care providers. It does also not require minimum training, It does not require regular inspections to happen in child care programs. And overall, minimum protections for children are not within the federal guidelines as of right now. So before we talk about what the changes on the horizon mean specifically for parents and families, I wanted to give some context about what we know about families and child care and what questions and concerns parents and families have around choosing a child care option. So what we did is we looked at 3 different major data points that we have here. First, we conducted a pretty comprehensive parent poll in 2008 that Child Care Aware of America, then NACRA, the National Association for Child Care Resource and Referral Agencies, conducted. And it was a nationwide telephone survey of over 1,000 parents and children with our parents that had children under the age of 6. And the survey recorded information about parents' child care arrangements for their youngest children. We also looked at parent focus groups that were conducted, about 14 focus groups in several different states between several different demographics. And this also included grandparents, Latino families, and families with migrant and tribal child care arrangements. And then we also had a very recent data point. We had about 20 family advocates came in September for our Family Advocacy Summit this past September, and we also did a focus group with them on questions, concerns, and issues that parents are grappling with in their individual states. So let's talk about what we found. So the overall findings is, was primarily that parents make logical assumptions about what the government's relationship with child care is. And parents really believe that government regulations were in place to support quality of care and learning for their children already in pretty high amounts. So 96% of parents believed all child care providers offered learning opportunities to children. About 82% of parents believed all providers were trained in guidance and discipline and behavioral issues. 78% of parents all assumed also that child care providers had some level of training in child development before working with children, and that 93% of parents, through existing health and safety standards, thought that those could actually be improved, and that their child care experiences were about average at best. And we just pulled out some of these. There's a lot of statistics, and we'll be happy to direct you to not only the findings that we found in this parent polling, but it does paint a picture of one, that parents really do make some assumptions about child care as far as quality, health, and safety go that may not actually be accurate. So also, there's high support for child care improvement initiatives in a lot of the polls and the focus groups that we conducted. There is support, as you can see on the graph table in front of you, that support for strategies to maintain or improve the safety in child care was very strong among parents. And it's not just parents that were polled in this survey. It was also grandparents and voters as well, so voters that may actually not have children. And a vast majority of parents, 96%, and voters, 95%, agreed that child care providers, for instance, should undergo comprehensive background checks. 95% again of parents and 92% of voters agreed that that providers should undergo regular inspections, for instance, same for specific training, and so on and so forth. So overall, in the general population, you can see that there's very high support for child care improvement activities among the population. So what major themes we find in a lot of our some of our more scientific analysis and also what we've been hearing from parents through different polls and focus groups that we've conducted. Some of the major themes are that finding childcare is really important if it's reliable and affordable. Also, that parents and families care that their children are learning new skills, that they're in a loving environment that's also clean and safe, and that in many places families can't afford childcare or that the quality of childcare is not available to them. Parents also assume that childcare programs are inspected for health and safety standards and that they receive basic training before working with children that childcare providers do. They also believe that childcare should be mandated, that this health and safety standards should be mandated and federally enforced, and that parents were actually willing to pay you know, for the most part, I think this was over 90% of parents are willing to pay more in taxes to increase health, safety, and quality child care options. Okay, so I wanted to make sure I gave background on the child care landscape and, you know, what types of questions, concerns parents as they're making this one of the most important decisions they'll ever make for their child, where they're putting their child in child care while they have to work, what they're really focused on. And now Nick will talk a little bit about what is on the horizon and specifically around the Child Care and Development Block Grant reauthorization. So I'll turn it over to him.
Thank you, Michelle. I think that was a great introduction into you know, a lot of what we're talking about, very relevant for this discussion. At this point, I wanted to put this slide up there, and I'll go into a little bit more. But what I really wanted to show was that a lot of this stuff has been happening over the past 2 to 3 years in Congress. And I'll come back to the slide in a little bit. But I wanted you guys to know that there's going to be stuff happening in the next month or so that could really impact what's going on in your program, what's going on in your community, and what's going on in your state happening here in D.C. That we really want to make sure that you guys, you know, have a good idea of what's going on and how it's really going to impact you. So I'll come back to this slide in a second. A little bit about CCDBG reauthorization. As Michelle said, CCDBG stands for the Child Care and Development Block Grant. We usually call it CCDBG because that's a lot easier and quicker. But one of the questions I want to start off with first before we kind of move into it is, what is reauthorization? And why does it matter? Why do programs need reauthorized? Hasn't this been in existence for a while without reauthorization, and what's going on? So the Child Care and Development Block Grant, as Michelle mentioned, was originally passed into law in 1990, and then it was reauthorized in 1996, which basically means they just said, okay, we like this program, we think this program has merit, so we're going to continue to fund it for a set amount of time, usually about 5 years. Well, when they did that in 1996, they authorized it until 2002. Well, since 2002, the program has been without authorization, but it's still been funded. So basically they've said, we like this program, we think it has some, you know, really helps families work and it really supports children. But we can't quite agree on reauthorization, but we'll still continue to fund it to make sure families are getting that support. So what's happened this year is, or last year starting, in June 3rd of 2013, 4 senators, Senator Tom Harkin from Iowa, Senator Lamar Alexander from Tennessee, Senator Barbara Mikulski from Maryland, and Senator Richard Burr from North Carolina, all got together and introduced S-1086, the Child Care and Development Block Grant Act of 2013 at the time. It's now 2014. So the act title has changed, but it's still the same act. And what was really impressive about just even the introduction of this is the first reauthorization in almost 18 years. So this is the last time since 1996 something has had this much movement on this particular program. So what's also very important to realize is the 4 senators who introduced this are quite possibly the most diverse and come from very different political backgrounds and very different political beliefs. You have two Democrats, Barbara Mikulski and Tom Harkin, and two Republicans, Richard Burr and Senator Alexander, who came together and agreed that, you know, they liked the program, they thought it was valuable, but they wanted to provide more supports for families and make sure there's better protections for children as well. So real quickly, what would S1086 do? You know, what are some main things? And after I go over the summary, I'll take you guys back to the timeline and kind of talk you through, well, what's happened, what did Congress do, what have they done, what haven't they done yet, and what's next. And then I'll kind of go through, you know, what direct impacts as you as either families or providers, you know, should really expect to see in your states over the next few years. So some of the basic things that were included in S1086 included comprehensive background checks for providers, pre-licensing and annual inspections, professional development standards going into place as a requirement for providers, the funds that the government, as part of the funding for CCDBG, the funds that they set aside to make sure that programs are working towards quality improvement and states are doing the type of activities that really are shown to improve the quality of care. They actually raised the percentage of funds that should go to that, or it would raise. The bill would also raise the eligibility period in states to 12 months. This is something I will definitely talk about more in depth in a little bit. And one of the other big pieces is it would designate a national toll-free hotline and website for referrals, quality information, and consumer complaints. So families would have a one-stop shop to kind of hit everything. So before I move on, I wanted to go back to the slide and talk a little bit about, okay, so I said it was introduced June 3rd. What's happened since? And, you know, did this follow, you know, actually follow the process of how Congress is supposed to work? I'm sure a lot of you have probably heard that, about how Congress actually works or doesn't work in some cases. But this bill has actually taken a very regular and traditional process getting through Congress. So it was introduced June 3rd. On September of 2013, they passed it out of committee. So they went around the Senate Health, Education, Labor, and Pensions Committee, talked about what they liked in it, what they did it, and then they all agreed by a voice vote basically saying, yeah, we all think this is great, and they passed it out of committee, which means the next step was that it would go to the Senate floor. Although it took, more than a few months to get to the Senate floor, in March of this year, after 2 days of debate, the Senate actually passed it by a vote of 96 to 2. Even if you're not a wonk and you don't live and breathe this stuff in D.C. or you don't live and breathe this stuff in the states, a vote of getting 96 legislators, 96 policy makers to agree on one thing, it's actually a pretty impressive feat and really shows how many people in Congress thought this was a crucial program to supporting families. So what happened next? The Senate passed it, which meant it went to the House. So the House had a hearing about the program in March, trying to figure out for themselves what they liked about the Senate bill, what they liked about the program, what they could change, where they could do stuff. And in September of this year, just a little over a month ago, the House, as well as leadership from the Senate, actually came together on an agreement where they basically said, we like this bill, we made some minor edits, we added some stuff, we took away some stuff, we changed the language and stuff, but both chambers actually agree with it. So it was a really strong step forward. And then only a few days later, on Monday, September 15th of this year, the House passed it by voice vote, once again, meaning they basically brought it to the House floor and said, this is great, we all approve it, and it goes back to the Senate now for them to do a final vote. So what happens is the Senate Majority Leader, Senator Reid from Nevada, scheduled a cloture vote, which is more or less a procedural motion to start debate, and then afterwards they'll have a final vote on November 13th of this year. So just a couple weeks away, a week after our last webinar of this series. The Senate will likely vote on, will have the cloture vote, and then if that passes, if that motion passes, which is at 60 votes, they'll move forward to a simple majority vote to pass the bill. Well, after it's passed, the bill will be, if it does pass, the bill will then be presented to the President for his signature, and he'll have about 10 days to decide whether or not he signs it. Well, what happens after he signs it? When does this all start taking effect? Is probably the question you guys are most interested in. So if the President does sign it, what happens is then the responsibility for implementing the bill is given to the Department of Health and Human Services. So at that point, they would take control of it, and they would have to release guidance to the states around how do you implement this, what other things should be included, and HHS will then decide, more on the timeline and how quickly some of this will be coming down onto states, in addition to the specific details mentioned around timelines in the bill. So that's a little bit just going into, when can you start expecting this, what's going on now. What we really want to talk about today is what impact will this have on you as a family or you as a provider. And I want to be very clear. CCDBG is a big program nationally. It serves about 1.5 million children monthly on average. And what that means is that although there's a lot of children and a lot of families receiving assistance and providers receiving assistance or accepting assistance, it means there's a lot of children and families and providers who don't participate in the program, even if they're eligible or even if they're not. And although this bill is focused on the funding that goes out through CCDBG, it does have a much wider impact that will impact all providers and all families. So it's important, and we wanted to make sure we kind of emphasize that, because I think that's one of the questions that a lot of people have been coming to us about is, I'm a provider and I don't accept, or I don't, care for subsidy children. How does this matter to me? Why should I be paying attention? Or I have a child, but we're not eligible for subsidy. What, does it make any difference to me? Or even in some cases, I'm a family who qualifies for subsidy, but have been on a waiting list for many, many years. Will this help? How will this impact, what's going on? So I actually broke it down into 4 kind of distinct groups. And although you can go quite a bit into, different specifics around who and what and where and how, we wanted to make sure that we talked about, first, families that receive assistance, because families that receive assistance, in addition to providers who accept subsidy children or vouchers, will probably see the most immediate and direct impact if this bill does move forward. So what are some of the things that I, as a family who uses or receives assistance from the federal government, how would S1086, if passed, affect me? One of the first things is that it would require all states to set a 12-month redetermination period for eligibility. So this means if you're in a state that currently makes you redetermine your eligibility for assistance every 6 months, you would have an additional 6 months. So you'd have 12 months between when you first qualify for it and start receiving it until you go through your next period of redetermination. So this is really important, and this was one thing that they thought was a crucial part of this bill, was ensuring that continuity of care for both children and working families was an essential piece of it, because they really wanted to, the research is there that shows how important continuity of care and consistency is for children, but also if you're trying to work, if you have a job and you're trying to work, to make sure that you have the opportunity to actually keep that and not have to worry about, oh, my 6 months is up, I have to go through this process again and possibly miss work or spend a lot of time that you really don't have as a parent trying to redetermine your eligibility and getting the paperwork together and getting to the office and going through the entire process. So that's one really big step forward that families who receive assistance will be impacted by if this moves forward. Another one is, as part of that, states would now have to explain how they're going to ensure flexibility for income and work changes. So one of the big topics that we, as well as a lot of other groups in DC, talk about is what's called the cliff effect. And what that means is basically if you're a family receiving assistance and you're doing great at your job, or you get a promotion or a small raise, that could actually in the past have bumped you from qualifying for assistance, and you would actually lose that subsidy. And in the long run, you would actually be worse off financially because you actually did better at your job, or you made a career step forward, or you advanced in your position. So one thing they really wanted to do was make sure states provided flexibilities for families, for working families around, well, I had a slight work change, or I had a slight job change, or I got a promotion, or I lost my job. There's some flexibility, at least providing a description of how they're going to handle that better. It's a big step forward. It may not sound like a lot. It may not sound, it may sound very vague, but it's quite a big step forward, especially coming from the national level. Another big piece is minimum health and safety requirement for all eligible providers. And there's quite a bit as a part of this, but some of the things that I really want to highlight is that if you are a family who is using a subsidy or using a voucher to put your child in child care, you will now have at least some assurance from the state that that provider has a background check, a comprehensive background check, including federal and state fingerprints, FBI name check, checks of the sex offender registry, and checks of the child abuse registry. You'll also know that that program was inspected prior to receiving their license, as well as once a year. And even if they're what's called a license-exempt provider, meaning that the state currently exempts providers around certain pieces of it or from all licensing, you'll know that provider, if nothing else, received a health, fire, and safety inspection, which means at nothing else, that provider has been ensured that they're complying with some very, very basic health and safety and fire practices. This is a way to allow, states some flexibility, as well as parents to have maximum choice if they do want to send their child to a license-exempt provider, typically one who the most common definition or most common use of that is faith-based providers. So it really does ensure parental choice and flexibility for both families and states. Another big thing, and I know this is something that a lot of people, both providers as well as advocates and families, should be really excited about, is there's going to be more information available to families and also easier to understand information. One of the goals of S10E6 is making sure that if the bill is truly about parental choice, it's about making sure that parents actually have the information available in a way that makes sense and is easy to understand, so they can go ahead and at least try to make an informed choice, or try to make the choice that best fits into their, into their own situations, without having to play a guessing game or without having to try and piece together information from different places. And another big piece is states are encouraged in the bill to delink unforeseen absences from reimbursement. And this is also a provider piece, but if you're a family and something comes up and you receive subsidy, you may be at risk to either lose that subsidy or not get it for a certain amount of time if your child has a certain amount of unforeseen absences that go above current state regulations. So what this does is encourage states to kind of give families, once again, more flexibility receiving care and subsidy programs into it. So that's, very specifically about if I use a subsidy or if I use a voucher to, place my child in child care, what would be impacted? So the bigger question is, how would this impact all families? First thing I want to mention is, although this does, focus on providers that are eligible for CCDBG funding, What that means is that because so many providers don't only accept children who have subsidy, they have some who accept subsidy and have more of their program who are co-pays or full-pay tuition students or children, means that even though they only have one or two, they're going to have to come into compliance for this as an entire program. So you're looking at an increase in health and safety requirements such as background checks, inspections, and training for programs who care for kids who aren't just subsidy children and families who aren't just bringing in vouchers. So you're going to see a much bigger impact than the 1.5 million children who currently take advantage of this program or who are eligible for this program. So as I said, you're going to see health and safety requirements be boosted in those programs. You're going to see inspections of a lot more programs, and like I said, once again, that's something that's going to impact a larger set of providers than just those who, just a slot to impact those children. Additionally, the inspection reports are going to be made available online for all programs who receive an inspection. So if you're a family who doesn't receive assistance but are looking for a program, you will know that if you're looking at a list of programs, you'll be able to go online and see, well, this program was inspected, on this date, and this is what was said about that, or this is what came out of that inspection report. So even if you're not receiving subsidy or not using subsidy or not eligible for it, you are provided with significantly more information around, well, is this program in compliance, or, did they have an inspection? And that really does help make a more informed choice, which leads us to the next point. The information available on the website and hotline is going to be available for all families. Yes, if you are a family receiving assistance, there's going to be greater information available for you, but even as a family who may be looking for child care in any situation, there's going to be a greater amount of information available for you, and a lot more information around, well, what is that program doing to improve the quality? Do they have teacher certifications? Do they have training that they meet? Are they going above and beyond the call? Are they doing the bare minimum? What are they doing? And that really will help parents make a more informed choice. They'll also have more information available about, okay, what providers are actually out there. And if I do eventually get on the subsidy program, well, which ones are eligible for subsidy and which ones aren't? Which is all stuff, we do a lot of work with families, all stuff that we hear about from them when they're trying to make, the very, very important choice about child care. And lastly, all providers, not just those accepting quality, not even those that have the blended, all providers will be encouraged to improve the quality of their programs through things like participating in a quality rating and improvement system in their states. And most states have that voluntary, but it gives providers an opportunity to really, express how they're going above and beyond the call, or how they're moving towards a program that really supports the healthy development of children. So that was a little bit about families. I'm going to move into about providers at this point. So if I'm a provider who accepts or is eligible for children using subsidies, or if I, open up slots in my program for children who are subsidy eligible, what does that mean for me? What do I need to start thinking about? Or what am I already doing that's going to be in compliance with this, and how am I ahead of the game? So as I mentioned before, one of the first things is comprehensive background checks for all staff. This means if you care for one or more unrelated children who are receiving subsidy in your program, you will have to have a comprehensive background check, as well as any staff or any unsupervised people in your care for. It goes through the entire things in the bill, but what you really need to know is that if you are in a staff or director, you are going to have to be required to conduct a comprehensive background check before caring for children. Additionally, there's greater professional development requirements and opportunities. So this is one question we get a lot is, a lot of providers look at professional development, and I'm sure a lot of people who are on this call or on this webinar look at professional development as an opportunity for them to provide better care. I know a lot of providers want to do their best to provide care. And you know, from what we've seen, that's a great majority of providers. But it is also comes down to, well, how do we have the capacity to do this? You know, how do we have the time to do this? Caring for kids is a full-time job for many, especially in family child care homes. So there's a lot of opportunities and requirements around making sure that providers have some very basic training, and they can go beyond that, but at least make sure that core competencies for providers are there. Things like first aid, CPR, safe sleep practices, disaster preparedness. Some of the very core fundamentals of training would be there. So another piece on that is around inspection. So I talked about this a little bit earlier, but if you are an eligible program and you are open to receiving assistance or you're eligible for assistance, before your state licenses you, you will now be required to have at least one inspection done to make sure you're meeting some bare minimum standards as determined by the state. The state will kind of determine, you know, what needs done as part of that inspection. But if you're a license exempt, you'll also receive just a basic fire health and safety standards, which meet, you know, some, once again, standards defined by the state. And you'll have this done yearly as well. So they just want to make sure that, you know, throughout the years you're complying with what's in place, or you're at least moving towards compliance with what's in place. Another big piece is the bill encourages and allows for funds to be spent on creating, implementing, or expanding a transparent system for understanding quality in each state. Most of you may be familiar with this as a QRIS system, Quality Rating and Improvement System. Some states call it that, some states call it their own. There's states that call it STARS programs or states that give them numbers. But what this means is that you as a provider will have an opportunity, if you believe you're a quality program, to put your program forward and to participate in the program, to make sure families actually understand that in a way that's meaningful to both you as a provider and them as a family. And like I said, this is something that all families could have access to depending on how your state works. And another piece that I mentioned before is the delinking of unforeseen absences from reimbursement. So I had this under families, but I also put it under providers because I think it's important. One thing we know is that talking to a lot of providers is that they really struggle with stability as far as funds from assistance, funds from federal and state assistance go, because it's difficult to kind of plan out their structure, plan out their schedule, plan out, you know, how their finances are going to work. If something happens where a child, one of their children who is receiving subsidies misses unforeseen days, and you have to plan on how your rate's going to be effective, and there's a lot of unknowns there. So once again, this is one thing that the bill would encourage states to kind of fix and work around and provide better flexibility for providers with regards to reimbursement rates. And lastly, I mentioned this as a big piece, but with things like the hotline and website and QRIS systems, one of the most important things is families are going to have much greater access and easier to understand information regarding your program. They're going to actually help understand if you are a subsidy eligible program, who you are, that you're out there, that you're eligible, that you care for kids in this way, that these are the quality standards you met, these are the compliance features you've met, you know, that you're kind of doing exactly what's out there or you're moving towards that way, so they can make an informed choice about, well, I didn't know this provider was there, let's look into them. So, you know, once again, that's a little bit about subsidy providers. What does it mean for all providers? So even if you're a provider who does not provide or not eligible to provide subsidy care in your state, what does this mean for you? Once again, there's going to be a lot more information available online for families to learn about your program. This, as I mentioned, really does include the QRIS system, which a lot of providers who aren't eligible for subsidy participate in a lot of states, but it really is a state-by-state kind of system. And, you know, a lot of states, the bill would encourage participation in that, and a lot of states would probably look to encourage greater participation in that. And once again, I talked about this earlier in part of the family piece. All providers, not just those accepting funds, not just those with some funds and you know, some full pay, all providers would be encouraged to accept subsidies and move towards quality improvement and move towards really building in more options available for families that, you know, can really be you know, beneficial to the development of children. And like I said, minimum health and safety for all eligible providers. But as I mentioned, many providers serve more than just children using subsidies. So there's, like I said, a bigger impact. As if you are a provider serving 1 or 2 children, or if you are a provider not currently serving children and not eligible, you have an opportunity to possibly say, hey, I already do a lot of this stuff. Maybe I could be eligible, and maybe that could help my finances in the long run and help my business in the long run. So I mean, that's kind of a very, you know, quick overview as far as what's going on, how could this be directly impacted. And I do want to mention before we open up for questions that, of course, a lot of this could be influenced by what happens with HHS, or if the bill moves forward and what HHS decides to do around guidance. They can add on to the bill, but they can't. If the bill is passed, they would only be able to you know, only able to do some pieces of it more, but they wouldn't be able to go beyond what the bill would set federally. And of course, the main thing is that states would still have a lot of flexibility around different pieces of that, which I assume, based on the fact we have a bunch of questions coming in, and please, you know, feel free to put your questions in there, is a concern as far as, well, how will this impact me in my state versus what we already do. So at this point, we're going to open it up for questions. I already see a bunch of questions in there, and it looks like a lot of you guys have some similar questions, so that's actually great. If you have a question, feel free to type it into your question box, and we'll try to get to it. So the first question, and I did mention this before, but the webinar and the slides, as well as future webinars, is available on our will be available by next Tuesday. On our usa.childcareaware.org/webinars page. You can find it there. But at this point, I'm going to move into kind of some of the questions you guys got. Maybe they'll answer some for you, as well as maybe make you guys think of some more as well. So the first one, I think this is a terrific question. What is the earliest date for state compliance with changes? So in the bill, the earliest date is mainly for pieces involving the federal government, mainly requiring HHS to comply with it. But as far as states are concerned, there are some pieces that are going to have to be described in the state plan. So states have to put together a description of what, you know, they're doing around this, how they're coming into compliance, how the next 3 years are going to look in their state. And that's really going to be the first date of compliance that you'll really see for states. But that doesn't mean states can't start implementing this beforehand. We've already seen some movements in states, and we do encourage states to, you know, at least see what's going on federally and have a good grasp of what they may have to do on top of what they're moving towards. But we've already seen states come into compliance with this in anticipation of what's going on. So although the federal dates are, you know, kind of black and white right now, but also a little bit of gray, your state could be moving ahead of the ball, or, you know, looking to do it. So I'd encourage you to make sure you're talking with people in your state to find out what's really going on there. So let me see. We have quite a few questions. So let me try to go through, at least from the beginning, and look at them. Are comprehensive background checks at the federal level? So when we say comprehensive background checks, it's actually 5 pieces. 2 pieces of that, or 4 pieces out of the 5 touch on federal data. and actually 3 out of the 5 also touch on state data. So it's really a combination of both federal pieces and state pieces. So you have the federal and state fingerprint checks. You have a federal FBI name check, so they just check your name, and then you have a sex offender and child abuse registry check. But the way the sex offender child abuse registry check is it's a national database compiled from state statistics and state data. So they really try to combine both of it. So you're getting a pretty clear picture of what's out there nationally and as well as in state. This is a great question. How would the national toll-free hotline and website support the state hotlines and website? Would consumers be referred to their local state CCR system? Absolutely. One of the main goals when they wanted to make sure the hotline was a centerpiece of the consumer education aspect of the bill, they really wanted to make sure they were already supporting what's out there. They really wanted to ensure that they didn't reinvent the wheel. This was something that I know they had a lot of conversations on. And one of the main pieces that a national toll-free hotline and website would do would still ensure that local or that families are being referred to their local CCRNRs. Because as many of us know, the local and state and regional CCRNRs really know the community situation for child care in their area. They know their neighborhood. They are the community child care experts and play a really crucial role to not only providing that information, but helping parents better understand what are their options, what other programs may they qualify for, where can they go from there, who can they rely on for help as well. So I think that was a great question and something that we'll definitely see a lot of focus on. Another great piece is how much flexibility will states have related to the 12-month redetermination period. For example, states may allow job search, parents may only need care for academic year or studies. Will states be required to provide 12 months of care for all families and in all situations? And how this impacts the number of families able to receive assistance? This is an absolutely terrific question and something that has been quite a bit a focus of conversation for many, many groups in D.C. as well as many legislators. So although it will be a 12-month redetermination period, states will have flexibility to decide how they discuss that or how they handle that among that. Job search is something in the proposed rule that the Department of Health and Human Services put out in May and would have to, reissue guidance. We'll probably discuss or will likely discuss because it's something that they want to ensure that there's at least some bare minimums, which is, from the federal perspective, ensuring a 12-month redetermination period. But states will have flexibility on top of that to determine how do they define job search, how do they define, fluctuations in income, how do they define short-term eligible care. On top of that, there'll still be a lot of flexibility in how states actually handle that. So it's really kind of yet to be determined, yet to be defined fully on how that works. But from a federal kind of baseline, it will just be providing that 12-month redetermination for families receiving care based on what they currently do. I'm looking at, we have, like I said, you guys have put forward a lot of great questions, and I'm trying to get to a lot of them, as many as I can. So this is another great one. Will S1086 provide funding for providers to get more education? The answer is yes and no, and I'll elaborate on that a little bit more. So S1086, if passed, would authorize greater funding on about a 2% increase every year through fiscal year 2020. But as part of that, they actually provided more funds for quality improvement activities, and in that, they actually defined training and professional development as an allowable activity. Well, as a organization that works with a lot of our members who are child care resource and referral agencies, that provide that training, that provide that professional development and education to providers, They actually allowed it as an allowable activity, meaning that there's going to be a lot more support and a lot more options for states to go ahead and use funds specifically focused for quality to do things just like that, just like education. What that means, though, is that it will really be up to states to determine where and how they use the funds. States will have flexibility to do it. They have a list of allowable activities that are guidelines for how they use it. But it's really up to the state administrators to determine, well, we have this money, we know what we can do, is this what we're going to be doing? So once again, we do encourage conversations with state administrators and people in your state to determine, well, what might they be thinking and what might be out there to help kind of provide, some ideas. Well, this is another great question. Our state currently has inspection reports online for our families. Will this law encourage our state to include the response of the provider if there are things that need to be fixed, if there was anything that needed to be fixed? So there's, a lot of questions about, well, we're posting the reports online, we're doing the inspections, but what's next? What, if there is something caught in here, what are the steps to take? There's actually about a 6-month period defined in the bill that states need to take compliance action steps and come into full compliance with it before it moves on in the state. And although states will have greater flexibility around determining, how this fits in their states, it does give them a guideline as far as what moving forward. Now, getting to your question, though, is whether or not this will be required or encouraged to be posted online. I think the bill implies it because it really does show that, we want greater information available to families, especially around inspection reports, but it doesn't necessarily outright require it and or encourage it. But based on kind of what the intent of the bill was, it very well could be HHS, the Department of Health and Human Services, intent to go to that step, or it could be something your state looks at as, well, we're putting a lot of other information online. It makes sense to us as a state to go forward with that. So it's kind of, both on that. Oh, and this is a clarifying question that I think is really helpful to kind of some of what I talked about. And maybe after that, I'll try to answer one or two more. So when we talk about unforeseen absences, what do we mean by that, and what kind of impact could that have? So unforeseen absences is something that, sometimes as a family who puts their child into care, there are things that come up that go beyond the pale of typical absences. So if your family is set to take a vacation, your child will not be programmed that day. Or if they're set for whatever reason to not be in that program that day, say you don't need care on Thursdays and Fridays, they'll be out those days. Some states count those as absences. Some states count those as days that aren't used for care. It really depends on how your state defines it. But generally, what states will be encouraged to do is if something comes up, as in a death in the family, or as in the person working who qualifies for it got sick and didn't need to put their children in care for that day, or for whatever reason, within the state's definition and within the state's guidelines, they could say, look, we didn't know this was coming. We really want to make sure that providers have the flexibility in actually planning. They have the stability in planning their budgets moving forward. That, this is at least encouraging them to do something to make sure that you're working with both providers and families to making sure that the requirements aren't hurting them or impacting them in a negative way without allowing providers to, and families to have to worry about, well, does this mean they can miss every day, or does this mean, that they have too much flexibility? It really will be up to the states, but it does encourage states to at least look at that issue and, start talking about it more. Well, at this point, I will follow up with maybe one or two more questions. One's a logistical, so I think, it would be helpful to answer that. And will there be a transcript of the questions and answers that we can access? and where can we access, information about this webinar as well as future webinars. So there won't be a transcript, but all of the questions are included as part of the webinar when we post it online. And if you do have difficulties accessing that or anything, please let us know. We're always happy to help.
And also as a follow-up, we will be coming out with a frequently asked questions, FAQ document. So we will be combining the questions that you all have so we can make sure that we get them answered.
And, as we look at what's next on our schedule, we actually have our next webinar coming up on Tuesday. And this one we'll be talking about what S1086 means for the quality set-aside and QRIS. So we're going to take a deeper look at, what does this really mean for quality set-aside, and quality rating and improvement systems? What kind of direct impact will this have on the quality of care, or what kind of impact does it intend to have? And we'll likely have a person from a child care resource and referral agency talking about what this really could mean for them and what this could mean for their state. So we really do encourage you guys to, participate in that. If you want a recording of our webinar that we did last Tuesday, this past Tuesday, as well as the one we did today, or the slides, they will be up there by the time we do our next webinar. And if you want to register for this webinar and future ones, you can find them all on that page. At this point, we would like to thank you guys for your attendance. And please feel free to contact either Michelle or I with any questions. We saw you guys had a bunch more questions, and we'll try to include them, as Michelle said, in the frequently asked questions. We definitely appreciate your guys' attendance today, and we hope you have a great rest of your Thursday and a great rest of your week. Thank you very much.